Welcome to the Back Talk Podcast, where we talk about your back so it doesn't talk back to you. Hosted by Dr. Peter Peduzzi, Clinic Director at American Back Centers. Each episode explores real solutions for back pain using non-invasive, non-surgical care designed to help you avoid spinal surgery. Helping people throughout the greater Pittsburgh area feel better naturally, without the hardware or the drama.
Chronic back pain does not happen overnight. Today, we're breaking down the hidden causes and the natural solutions that actually work. Welcome, I'm Julie Schwenzer, co-host and producer with Dr. Peter Peduzzi, the Clinic Director at American Back Centers. Dr. Peduzzi, thanks again for joining us. It's always great to learn from you.
Thanks for having me again.
So, what causes chronic lower back pain and how can non-surgical care help?
Chronic low back pain typically happens over a period of months, if not years. The chronic stresses that occur to us, whether it's physical, chemical, emotional stresses, relationships, car accidents, sports traumas, the day-to-day activities, sitting prolonged, all these things add up over time. And in many cases, people will have one incident, the pain goes away, and then it comes back, and then it becomes more of a constant problem, whether they address it with pain medication, epidural injections, which are typically Band-Aids, or if they actually address it with a structural improvement like what we do here at the American Back Centers.
And what about inflammation? How much does that contribute to long-term lower back pain?
Inflammation can be a big problem. You can have inflammation from a number of disease processes of the body, and that inflammation can add up over time due to like a poor diet, which can promote inflammation in general from outside stresses, which over time can accumulate and cause problems in the body and wear and tear on the body.
And I know we've spoke about this before, but disc problems, how do you determine when it's a disc that might be the primary source of the pain?
Well, disc is soft tissue. So anytime you have a soft tissue issue, typically we require an MRI to actually see the disc. Now, we can start with an x ray to see the spacing and loss of spacing between the vertebrae of the spine, but that just gives us a kind of a brief picture, beginning picture of what may be going on. And the MRI gives us a definite diagnosis of a disc problem because you can actually see the soft tissue with an MRI.
And like you mentioned, sitting all day can also contribute to chronic back pain. Any changes that you recommend to prevent chronic pain from somebody who, for what they do, maybe like a truck driver or, just somebody in the office all day that they can do to help prevent, it from getting worse?
Yeah, I mean, someone in the office is a pretty easy fix, getting up and walking around using a standing desk. The standing desk is becoming more popular. We prescribe them all the time for our patients. Getting up and walk around, getting a glass of water, taking a break per se here or there. Now, the truck driver is a little bit more difficult. Somebody who's a salesman, maybe driving around door to door, or like we said, a truck driver, they need to take breaks. There is an air ride in many trucks that helps to absorb some of the pressure, but basically it's just taking breaks and being cautious about when they're sitting prolonged. Then they go and unload a truck in many cases, lifting heavy objects. That's the perfect recipe for a disc problem.
And you've explained before how non-surgical treatments restore function. What improvements do patients usually notice first when they try this?
With the non-surgical treatments, we're actually addressing the structural cause of the problem, which is compression of the spine and nerve compression. So we can get true healing with that. So what they're seeing is over time, the spine is compressing. So we're actually decompressing, opening up the spine. Those nerves are being pinched. If a disc is pushing on the nerve, we're going to pull the disc off that nerve, open up the spine, open up those canals where the nerves can be trapped. So even spinal stenosis, which is narrowing of that canal, can be relieved when we open up that canal, taking the pressure again off the spine and off the nerve.
And if somebody's been in pain like for a very long time, um, can you say that it's pretty safe that a non-surgical option is, always possible? Or maybe not, but, how do you diagnose that and how do you say, okay, we can do this first before you have to do something more aggressive?
Well, I mean, a detailed history, physical exam, in many cases, X-ray and MRI will show us what the problem is. But more importantly, we want to make sure we do no harm. So we make sure there's no contraindications. We go over that with the patient before we even talk about a treatment program. Then, of course, we make sure there's indications, reasons why the treatment could help them. And if that's the case, we have an over 92% success rate if the patient is a good candidate for the care.
Okay, and any other advice to anyone that might be, trying to do what they can day to day, or trying to take up more exercising that may help their back overall?
Yeah, I mean, with our patients, initially, when we diagnose them with a disc problem, we kind of take a step back from certain things. But as soon as we get the patient into active care, walking on a flat surface, walking on an elliptical machine as opposed to a treadmill, no running or jogging because that's going to compress the spine, or swimming in a swimming pool, moving around in the water, you can do a lot more in the water with less compression on the joints, less compression on the spine. Then we graduated them to a structured therapy program concentrating on building up their core strength, which will help prevent problems down the line.
Okay, Dr. Peduzzi, thank you so much for breaking that down clearly. We always appreciate your insight.
Well, thank you so much for having me again.
Thanks for listening to the Back Talk Podcast. If back pain is slowing you down or bossing you around, it may be time for a natural approach that works. Call 724-935-3300 to schedule a consultation with one of the doctors at American Back Centers, or visit AmericanBackCenters.com.
At American Back Centers, you've got nothing to lose but the pain.